Most people are aware pyroptosis is an inflammatory mediated cell death process that is felt to be very important in various types of diseases, including some cancers such as myelodysplastic syndrome. And in MDS, it is felt that the inflammasome, which is the inflammatory complex that results in this pyroptosis effect, is upregulated in MDS, especially low-grade MDS, and is associated with ineffective hematopoiesis. And one of the byproducts, or one of the end products of the inflammatory complex, or the inflammasome, is the production of IL-1 beta, which we feel helps to drive the overall inflammatory process, and also serves a paracrine effect by potentially upregulating the inflammasome itself to lead to further upregulation of IL-1 beta and ultimately ineffective hematopoiesis. So our group, led by David Salman, who is the leukemia section head at Moffitt Cancer Center, has led an early phase clinical trial testing Canakinumab, which is an IL-1 beta antibody, in conjunction with Darbepoetin, to try to test this theory of the ability to block the inflammasome effect and perhaps improve hematopoiesis, especially erythropoiesis, in low-risk MDS patients. So we have piloted this study to date in patients with low-risk MDS, patients who had either symptomatic anemia or transfusion-dependent anemia, patients who had prior ESA failure, and patients who were HMA naive. We didn't want to muddy the water too much by having very heavily pretreated patients on this particular study. So it was really intended for the lower risk transfusion-dependent patients with MDS. And patients received Canakinumab once per month, and they received Darbepoetin every 2 weeks. And the intended treatment duration was about 6 months. And in this early phase pilot type of trial, what we've seen to date and what is being presented at the ASH meeting by Dr. Salman this year is the fact that the drug was well tolerated. There were no significant treatment-related or treatment-emergent adverse events. There were a couple of patients with mild cytopenias that emerged during the treatment, which potentially were related to the drug, but no serious adverse events. We did not yet observe any objective erythroid or other cell lineage responses in this early phase of the study. We had patients with stable disease, no evidence of disease progression. At the pharmacodynamic level, what we observed in this study was the presence of downregulation of the NLRP3 complex that indicated that the inflammasome complex was actually decreasing as a result of this IL-1 beta inhibition. And we saw a decrease in the actual levels of functional IL-1 beta. So it seems that Dr. Salman and our group has shown that there is a pharmacodynamic on-target effect that's occurring with the Canakinumab, and hopefully this, in a larger expansion of the study, will result in an observation of clinical activity as well. So the study is being expanded to focus more on patients that have potentially a higher likelihood of inflammasome-driven hematopoietic failure with MDS, namely patients with DNMT3A or TET2 mutations, which are known to be highly associated with upregulation of the inflammasome complex. And we'll be looking to see if that particular population, if we enrich for that group, we'll start to see some evidence of clinical activity that justifies the utilization of Canakinumab and hopefully allows it to become part of the treatment armamentarium. We're also looking at the same drug, Canakinumab, based on its mechanism of action as a potential therapeutic approach in precursor conditions such as clonal cytopenia of unknown significance. So I believe that we'll be seeing a lot of targeting of this particular inflammatory pathway in early MDS and precursor conditions moving forward based on the mechanism of action.